Welcome to our YouTube channel. What is first aid and do's and don't? First aid refers to the immediate medical assistance provided to a person who has been injured or has fallen ill suddenly. First aid aims to preserve life, prevent the condition from worsening, and promote recovery. Here are some key aspects of first aid. Assess the situation. The first step in providing first aid is to assess the situation to determine the type and severity of the injury or illness. Call for help. If the situation is serious, call for emergency medical services immediately. Provide basic life support. If the person is not breathing or has no pulse, perform CPR, cardiopulmonary resuscitation, until medical help arrives. Stop bleeding. If the person is bleeding, apply pressure to the wound to stop the bleeding. Treat for shock. If the person is in shock, lay them down and elevate their legs to improve blood flow to the heart and brain. Treat burns, fractures, and other injuries. Depending on the type and severity of the injury, provide appropriate treatment such as cooling a burn, immobilizing a fracture, or providing pain relief. Provide comfort and reassurance. Provide comfort and reassurance to the person, and keep them calm until medical help arrives. It is important to note that first aid is not a substitute for professional medical care. It is a temporary measure until professional medical help arrives. It is also important to receive proper training in first aid to be able to provide effective assistance in case of an emergency. Do's and don't in first aid. Here are some do's and don'ts to keep in mind when providing first aid. Do's. Assess the situation and provide assistance to the best of your ability. Call for emergency medical services immediately if the situation is serious or beyond your ability to provide assistance. Stay calm and provide comfort and reassurance to the person in need. Apply appropriate measures to stop bleeding or stabilize injuries. Perform CPR if the person is not breathing or has no pulse. Seek professional medical help for further treatment and care. Use personal protective equipment, PPE, to protect yourself from infectious diseases if there is a risk of exposure. Don'ts. Do not panic or become overly emotional. Do not provide medical treatment beyond your level of training or expertise. Do not move the person if there is a risk of further injury or if they have a suspected spinal injury. Do not remove objects embedded in the body or move objects that are impaled in the body. Do not give the person anything to eat or drink if they are unconscious. Do not administer medication or use medical equipment that you are not trained or authorized to use. Do not leave the person alone until professional medical help arrives. Remember, providing effective first aid requires proper training and preparation. Always seek professional medical help as soon as possible and follow the appropriate protocols for your level of training and expertise. Thanks for watching.